Hello and welcome. Women continue to lose jobs even as men have regained most of the jobs they lost during COVID-19. So why is this happening, and what does this mean for the challenges in terms of larger gender empowerment and gender equity, not just in countries like India but the rest of the world? So joining me to speak about this and in the context of gender equity is Dr. Christopher Elias, President Global Development at the Bill Melinda Gates Foundation. He oversees global development's portfolio in emergency response, family planning, maternal, newborn, polio eradication, nutrition, and vaccine delivery. He used to earlier be CEO of PATH, an international non-profit in the health space. He is a MD from Creighton University, a postgraduate training in internal medicine at University of California, San Francisco, and a master in public health from the University of Washington. Thank you very much for joining me.
Govind, it's great to be here.
Great. So let me pick up on women who've lost jobs. Now, I know that organizations like yours have been working on improving and increasing women's access to the workforce. But COVID seems to have upset this apple cart in more ways than one.
Yeah, Govind, as you know, I mean, COVID's been a shock to the world for the last couple of years. And I think it's exposed some of the things we knew, right? Which is that women's jobs are more vulnerable. They're more easily pushed out of the workforce because their jobs are less secure, they're often in the informal sector, et cetera. And as COVID is situations improving, it's also harder for them to get back into the workforce. Partly because of the informal nature of many of their jobs, but also because of the significant burden of caregiving, right? Of, if schools aren't open, if childcare centers aren't open, and elder care is been weakened by the pandemic. There's a set of barriers that are gendered that prevent women from being able to re-enter the workforce. And we've seen this around the world. And I think that's part of the challenge. It's shown us some of the vulnerabilities, that how we undervalue the unpaid work of women and how we need to redouble our efforts, if you will, on women's economic empowerment.
Right, so you talked about the fact that most of these jobs are informal. Now, if we were to look at policy interventions, what would they be then? One is, I'm assuming, formalization of labor, which is easier said. But what else could governments do, for example, to ensure that women have some sort of more formal relationship with?
Well, I think, continuing the journey of creating economic opportunities for women in both the formal sector and in the informal sector. And I think another key thing is providing the social safety net. And I think this is, one of the things that India, as I understand it, did very well in the COVID response, using the women's groups, the self-help groups and other women's economic collectives as a way to facilitate an early access to direct benefit transfers and really shore up the social safety net for women and their families, because women play a very important role in the security of the family in general. And so having that resilience that the self-help groups and others add to communities as an avenue for providing that social safety net, I think has been quite important as well.
Right. So let me expand the theme a little bit. And if we were to talk about overall gender equity and going back to pre-COVID times and the areas that you were working on, one of them clearly is family planning. Mm-hmm. Tell us about what are the determinants at work here?
Well, the key goal in family planning programs is to give women choices, to give women women and their partners the opportunity to decide when to have children, how many children to have, and to give themselves the predictability around how to safely time their pregnancy so that they're healthier. We know that having pregnancies too early or too many or too closely spaced is a bad thing for women's health and for the health of their children. So family planning gives women the opportunity to help plan the timing and spacing of their children. And that's important because it benefits them individually, it benefits their family, it benefits their communities, and ultimately the nation. And we've seen considerable progress. This is my first trip to India in a few years because of COVID. And I had the opportunity earlier this week to visit some of the work that we're doing in Bihar, and to actually go out into the community and to meet with some of the women in some of the self-help groups who were able to describe how they were part of that resilience in the community, how they use their networks to start making masks, and providing them, how they were part of the COVID response, as well as part of that resilient safety net for their communities.
Right. So, when it comes to, let's say, empowering women in the context of family planning, would you say it's a communication challenge, or is it a broader policy challenge?
I think there are several challenges, which I think we've learned from family planning programs around the world. One is providing accurate information about the availability of contraceptive methods, providing a range of contraceptive methods, because women will have different preferences and they'll have different experiences with side effects. Counseling women about side effects, what to expect and how to manage them, etc. And to provide services that are readily accessible by women, and to provide information. And so I think one of the things we've seen is that as the frontline health workers have been able to provide more direct information and counseling to women in their communities, the ASHA workers and others, we've seen a significant increase in the rate of contraceptive utilization. I had the opportunity this morning to review some of the preliminary results from the National Family Health Survey, which shows that over the last 5 years there's been a significant increase in contraceptive prevalence, particularly in some of the northern states like Uttar Pradesh and Bihar.
Right. And as you look ahead, family planning will, let's say, bring about greater balance and empowerment. What's next? What's the next stage that, policymakers need to think about in order to make them, let's say, a productive contributor to the economy?
Well, I think that, one of the kind of core public goods, if you will, is a strong primary health care system. And so I think, because the primary healthcare system, rather than focusing one disease at a time, having a strong and resilient primary healthcare system allows the health system to meet women's needs as they evolve, not just women's needs, but children's needs and men's needs as well. And so, some of the recent efforts to expand the number of health and wellness centers, I had an opportunity to visit one earlier this week in Bihar. These are the kinds of efforts to extend access and quality of services for the basic primary health care, which is, across the world we see that most health problems can be prevented or treated early at the primary health care level. And that then saves the system resources, because then that means fewer people are getting very sick and showing up at the higher levels of the healthcare system.
Could you illustrate that? I mean, suppose you had a set of 10 medical conditions. What would be the ones that could be addressed because of prevention rather than?
Well, so the number one example, I think, and one that India has been particularly successful at, is expanding childhood immunization. We can now prevent some of the most common causes of under 5 child mortality are pneumonia, diarrheal disease. And in the last 10, 15 years, new vaccines have been developed for these diseases and have been introduced. One of the things that India has been very successful at, even during the COVID period, is rolling out the new pneumococcal conjugate vaccine, which, again, I had the opportunity to see children receiving in Bihar this week. And that vaccine addresses the number one cause of under 5 child mortality, which is pneumonia. And where it's been rolled out at scale, and the coverage rates of childhood immunization have consistently improved in India over time. And India has introduced quite a few number of new vaccines, including the rotavirus vaccine, the pentavalent vaccine, and now the pneumococcal conjugate vaccine. These are by providing children with this full set of immunizations, you reduce the problems that were not only a source of mortality, but for many children resulted in the need for high levels of hospital care, et cetera. So immunization is one. I think a second one is nutrition. You know, one of the things that we at the Gates Foundation work closely on with the ministry here on the Poshan mission and the efforts to improve nutritional conditions around the country. So nutrition is another important area that primary health care can address, that well-nourished children and young mothers are healthier and again are less likely to get more severe illnesses that might call on the system. So and then there are other new things like hypertension, other non-communicable diseases we saw again were a focus in some of the new health and wellness centers. So there's a range of conditions, and rather than going after them one by one, building that resilient primary healthcare system is a way for addressing all of them, because different individuals will have different challenges, different health challenges, and different communities will have more of one disease or another. And so having that resilient system, I think, is the best investment.
And you're also seeing, I'm assuming, a rise in non-communicable diseases, because that's what the data shows elsewhere.
Yeah, I mean, that's generally true across the world. And it's true certainly proportionally, because we've made such good progress in reducing morbidity and mortality from infectious diseases by preventing them in the first place through access to a wide range of immunization, and also by treating them quickly by having a stronger primary healthcare system.
So, as we've learned to cope with COVID and responded to it, what are the lessons that we can take away in two levels? One is the structure of the healthcare system at the primary level or at the secondary level. And secondly, in terms of anticipating future pandemics, if we can, and responding to them.
Yeah, so there's I think an important conversation starting about how do we prepare, how do we have greater preparedness for not just the next pandemic, because pandemics come, right? Influenza causes pandemics, but even between pandemics, there's outbreaks of other diseases. And so how do we begin to think about having a better preparedness and a more rapid response? There are a couple of elements to that I think are important. One is having better surveillance, developing an integrated disease surveillance system so that when a problem arises, whether it's a diarrheal disease outbreak or a pneumonia outbreak or a pandemic, that we see it early.
Dengue, for example.
Yeah, the sooner we see it, the quicker we can then respond with an effective public health response. So I think improving our surveillance for disease, and surveillance is a key component of a strong primary healthcare system, so that if a cluster of strange syndromes occurs, that it's noticed and that it's notified up to the public health system so that a response can be generated. I think also one of the things that we've seen around the world is that the places that had stronger primary healthcare systems were more resilient. And then similarly, and I think this was very evident in my brief visit to Bihar, having that community organization, the self-help groups here in India, have really been an important part of the resilience of communities, to understand how to care for individuals when they were ill, how to support one another, how to get the additional food rations out to people, how to be part of that social safety net, as well as to then do important things like the mask production that I saw from the self-help groups up in Bihar. So I think building resilience both for the primary healthcare system as well as for that community organization and self-help groups has been it's an asset that benefits the community every day, but it also is an asset when the community is under stress from an outbreak of disease or a new pandemic.
Right. And surveillance is an important word. And talk to us about what more can be done in general, and maybe the role of technology in either collecting the data or disseminating it faster to those.
Yeah. So there's a couple of ways to think about surveillance. One is to just have a well-trained health workforce that recognizes when something out of the ordinary is happening. That can be then complemented by specific diagnostics. And I think one of the things we saw in my visit to Bihar, the health and wellness centers are introducing a broader range of simple diagnostic tests that can be done at the primary healthcare system. So technology has a role in terms of improved access to specific diagnostic testing. And then the other thing that's, I think, revolutionary is having a digital information system that allows those observations, either from the healthcare workers or from the diagnostic testing, to be shared very quickly with decision makers who can then act upon that. So, and that's where I think, India has really been an exemplar for the world in building its digital financial inclusion, and it's the digital stack that has enabled mobile payments, et cetera, and also simple things like being able to verify immunizations and having an app that we now have been talking to countries in Africa and other places about how they might use a similar application that building on effectively using the application that was developed for COVID immunization here in India in other countries. So I think this is a good example of India being on the leading edge of innovation, not just for this big country, but also actually producing public goods that are going to be helpful elsewhere in the world.
Right, and again, going back to what we've learned from COVID, or maybe not learned, how could we, use that learning to, and you've touched upon this already, to improve our overall public health response, and surveillance being, I guess, and immunization being two very critical components. But what else are you thinking about or looking at?
One of the things I'm most excited about, it's hard, COVID's been such a challenge for every country in the world over the last 2 years that you have to try and find, was there anything that comes out of this that would be a lasting benefit. My best example of that has been the efforts to build stronger systems for oxygen support. Prior to COVID, the number one cause of under 5 child mortality around the world was pneumonia. And many of those children's lives could have been saved with more ready access to oxygen systems. And we were making some incremental progress in expanding oxygen systems before COVID. What COVID did is it stressed the entire system. Oxygen systems were in short supply in most countries. And that helped to get the political awareness and commitment to strengthening those systems in the short term to respond to COVID-19. But if coming out of the pandemic, we can build stronger and durable oxygen systems, that will then serve us to deal with the next pandemic of respiratory illness, but also to save children's lives every day from what is the number one cause of child mortality, which is pneumonia. So I'm hoping, and this is one of the areas that the Foundation's been working with the government of India, both at the federal level and at state level in UP and Bihar, has been to help work on strengthening those oxygen systems. I think that, like surveillance, we come out of the pandemic knowing we have to do better at surveillance, knowing we need to do better at strengthening primary healthcare systems, and as a component of that, thinking about how we strengthen the oxygen access so that and that's complicated. It's more than just a tank of oxygen. It's how do you produce the oxygen, how do you move it, how do you make sure hospitals and primary health care centers have enough of it, et cetera. So that systems thinking about a critical life-saving commodity like oxygen is another important learning, I think, that we'll take out of this pandemic.
And anything on the research that actually goes into creating a vaccine at this speed?
Yeah, I mean, I think that's one of the things to step back and celebrate out of COVID-19 is how quickly science came up with tools to help us manage the pandemic. You know, it was just over a year from when the COVID-19 began that we had effective vaccines. That's never happened before. I think the fastest a vaccine had ever been made before was 4 or 5 years. So science was on our side, and India played a very important role because, you know, India is the largest producer of high quality and affordable vaccines for the world. I think the figure is about 60% of the vaccines used in the world are actually manufactured in India. And the Indian vaccine companies responded quickly with new science to produce vaccines, not just for India, but for the world. So Indian vaccine manufacturers, which we've been happy to support together with the government of India, have been a critical part of the response both nationally and internationally. I think the largest supplier of vaccines to COVAX, which is the global vaccination initiative focused on low and middle income countries, has been coming from Indian manufacturers. So India was very successful in taking a remarkable capacity for vaccine manufacturing, harnessing that new science, and producing vaccines at scale very, very quickly. But producing vaccines isn't enough. You also then have to deliver those vaccines, and that's been one of the more impressive things in India is how quickly the government organized to work with many different partners to actually get vaccines from the factory into people's arms very, very quickly. And so that progress, which builds on having had a strong immunization system, good systems like the COWIN system for tracking vaccines, tracking them through, you know, the cold chain, et cetera, to provide them to people, to get them out to people wherever they live, to provide them for people at different hours. I heard again in Bihar about a program to make vaccines available from 9 a.m. to 9 p.m. So if people didn't have to take time off of work to be able to go and get the vaccination. So India has been an exemplar of harnessing the new science and getting it out quickly as possible. And I think that's played an important role in being able to address the latest wave of the Omicron variant that's been surging. Lots of cases, but much, much fewer cases of hospitalization or mortality. And that's been very important for India, but also having that manufacturing capability which serves the world.
Right. So let me come back to on the question on women and empowerment. Sure. And we talked about, or rather I asked you about the jobs conundrum. If you were to now look ahead, what do you think would be more, let's say, the kind of thinking that policymakers have to do if we have to address these 2 or 3 challenges? One is, I think, the challenge at home, ensuring that they are able to maybe either vaccinate or provide the right immunization for their children. The second is outside. How could they become more productive members of the workforce? I mean, women and health, I'm assuming, and go together in many ways, and a policy response should also take that into account. So what's the forward thinking in this area?
Well, so, you know, women's economic empowerment has many, many dimensions, and I think that the COVID-19 pandemic, I think, should help us remember that the hard work that was being pursued on improving gender equality before the pandemic is even more important, because it showed us that women were more vulnerable to losing their jobs. They had greater responsibilities for caregiving for both children and elders, and et cetera. So continuing that journey of women's economic empowerment is even more important now as we come out of the pandemic than before. And there are many elements to it. One is education, beginning with, because if you think about the pathway to a job, right? Having an education, we know that educated girls and women begin they marry later, they have children later in life, they're more likely to be established economically, et cetera. They ultimately have fewer children and better spaced children, which is better for their health and their children's health and the broader family. So, you know, continuing those education, those interventions around expanding girls' education, encouraging access to family planning so that women have control over the timing and number and spacing of their children, and giving them the choices to be healthy and to be economically active. And then, you know, working to create jobs that recognize that women, you know, are equal in being able to do those jobs, and to give them a greater social benefits in terms of when there is a challenge and they have to be out of the workforce for caregiving responsibilities, et cetera.
Right, that's a good note to end on. Dr. Elias, thank you very much for speaking with me.
Thank you, Govind.
Thank you.